Okay, so Dr. Dodson, one, welcome to our podcast. I appreciate you again doing this today. Um, when it comes to your job and comes to therapy and your profession, when did you decide this is what you wanted to do with your life?
Good question. I decided that I wanted to be a therapist when I got to college. Prior to then, I wanted to be an attorney, and I had traveled with the mock trial team, got trained by some of the best attorneys in Memphis. I'm a native of Memphis, Tennessee.
Okay.
And I got to college at UT Chattanooga, saw the curriculum. At freshman orientation, they show you what classes you'll take. And I learned that I had to do a foreign language to do a law. And I said, well, that's not going to happen. And I knew that I wasn't going to do anything with my hands or numbers. I just wasn't that type of kid growing up. But I'd
Yeah.
always been able to use my words. I was always able to see people and empathize with people. And I saw the curriculum for psychology, and I just said, okay, boom, let's do this. And I stuck with that major all 4 years. At the end of undergrad, they say applied to 10 graduate programs. I did not do
Mhm.
that. I applied to one. Luckily, I got into that one master's program for counseling, and the rest was history. So I really attach it to purpose. That's what I was supposed to do,
Yeah.
and the curriculum made sense to me.
They- They've been quiet all morning, and
Yo,
it's like the
it
moment I get on
never
here.
fails. It never fails. Every Wednesday, my neighbors have their yard guy come at the time where I have something. I feel you.
It's unbelievable.
Yeah.
Okay.
We roll with the punches.
We roll with the punches. This is real life.
They
Um,
punching though, yeah.
they punch. so,
Right.
so when you decide this is what you're going to pursue, were you always somebody that was like good at listening to like your friends and family and giving advice and being that person?
Yeah. I think honestly, a lot of clinical mental health professionals start as people pleasers,
Yeah.
and we start as that voice of reason in the family when that is completely not what therapy is, right? So I think earlier on in our lives, we give advice, we're level-headed, and then you get to study the program and you realize that therapy is not just giving advice. But I typically was that person who would be the person in the room to listen, to empathize, and I think it really started when I lost my father. I remember the day he passed. My mom was on the phone with 911, but she was screaming and hysterical, so she couldn't communicate. My brother was frozen in place, and then that really put me into action because I had to do something. So I think that starting then, that really catapulted me into the person that is going to do something to stand in the gap and help other people. And so luckily, I was able to find that through a profession where I can also take care of myself, but live in purpose through the work that I get to do as a therapist. But I do think a lot of us start as that go to person, and then we really learn what the craft does.
Now, that's interesting. A couple of different ways. So you were home when your father passed away?
Yeah. Yeah.
Wow.
I'll never forget the day. Yeah.
If you don't mind me asking, how did he pass away?
Yeah. So later on, we found that he had a heart attack. So my father was
Okay.
in his 40s. He went to Tennessee State University, played in the band. He was a social worker. My mom always worked for the city of Memphis as a clerk and an analyst. And so, actually, that Friday night, we lived in a small two-bedroom apartment, and we were paying for a vacation to go with my cousins. The next morning, my brother and I woke up to hearing my mom scream, and before we knew it, we were watching our father have a heart attack. And so I remember that day as being so significant because that was probably the most traumatic thing I had experienced to date as a child. So he
Right.
passed when I was 9. The next day I turned 10. And I think life started over then because then I took on different responsibilities. Oftentimes, when children have a parent that is missing or unable to care for them, then you become parentified at an early age, meaning
Mm.
you take on responsibilities that otherwise an adult would do. So
Yeah.
life really changed overnight. And I really always valued education, loved it. My mom didn't finish college, but my dad did at Tennessee State. And education was always instilled in us. So traumatic experience paired with education, finding purpose, different jobs really led me to where I am today.
Yeah. It's it's interesting. Like there's a lot of men who lose a parent at a young age from different things. It can be substance abuse, it can be, death, it could be the person walking out. And a lot of us at a young age take on that responsibility, even though it may not be asked of us. It's what we almost kind of feel like we have to do. And I think it strips us from a lot of the innocence that you should probably have going through childhood. And then you take on the same responsibility as an adult, to where you're always trying to fix things,
Hmm.
and it's not your responsibility.
Yeah. And I think I love the what you say, the word responsibility, because I think it's twofold. I think sometimes kids truly are asked
Yeah.
to step up to the plate, to be that latchkey kid, to cook for your siblings, to let yourself in, walk home from school. And then other times we just can feel the emotional um, weight that one parent has to be able to figure out life. And so as I grew older, I realized, well, life didn't just change for me overnight in that moment. Life
Yeah.
changed overnight for my mom and my brother. But for so long, I think growing up, learning to learn myself, I played the victim oftentimes until I was able to do my own work later in life with my own therapist and figure out, okay, that was a part of your story. That was a part of your life. How do you use that to really find the purpose in the work that you do, which led me to working with adolescents, many who
Yeah.
had parents that were missing. So I worked for a nonprofit with a group home with boys ages 14 to 16. So that was my first internship, first job. For
Hmm.
years, that was the work that I believed in. And so I think that I wouldn't have been able to effectively step into those roles if I hadn't had that life experience.
Right.
A lot of therapists, in my opinion, are better providers when we do have a lived experience where we can speak the language and understand the dialogue of our clients who are also hurting, because
Yeah.
we've been able to figure out and navigate how to manage some of the same life experiences.
Yeah. I worked at a boys group home for maybe about 4 or 5 years, while I was in school, and it was that same thing. So I lost my brother when I was 16, to gun violence, and it's like I felt like I wanted to do something to try to like guide people away from that.
Hmm.
And it's like stepping into that space. It was great for me feeling like I'm making a difference. Hopefully, it like has some impacts on some other people. But then it was always like that knack of like, your message needs to be broader. It needs to be bigger. It needs to get to more people instead of like just the 12 people that are in this program. So
Yeah.
it's trying to find out. It was a wow trying to find out like what that voice would be and how to utilize it. Um, so with that, I of course I'm going to ask. With younger kids, you said that you felt that um, you played the victim role until you were able to process what actually was going on. Um, do you suggest that parents put younger kids into therapy, like in that adolescent age, and kind of like allow them to talk through things with someone who isn't invested in their lives?
You know, it's interesting you asked that question. After my father passed, my mom did put my brother and I, all three of us went to therapy. I'll never forget what the lady looked like. She was an older Black woman. I'll never forget the building. But I remember at the age of 10, I had a bad attitude towards therapy or any external person trying to help me, because in my mind, I was okay because I had to be okay in
Yeah.
order to make sure everybody else felt okay.
Yeah.
So the narrative that I had was, okay, Justin, you're okay. This happens. And I mean, I'm 10, right? So I'm
Right.
having
Right.
these conversations with myself. So I go into therapy with this lady, and I remember being silent. I mean, nasty attitude, rude, because I was really rejecting the process, because there's no way I need you, ma'am, if I've convinced myself that I'm okay for my family. And so I'm saying that to say yes and no. I think that parents know their children better than anybody else. And I think that if you believe that your child has the emotional capacity and wherewithal to enter into a program like that, I say absolutely get the help. I also think that if I think mentorship, community, connection to other people can be just as helpful until a person is ready and has the emotional capability to go into therapy.
Yeah.
At that age, I didn't understand it, but they are doing therapy much younger and younger these days. So play therapy and therapy for children really young, which I think is helpful. There are studies that show that it's effective, but it really just depends on your access to resources, how well you know your kid, and really asking your kid actually what they need. Right.
Yeah.
So there wasn't a choice to go to therapy. My mom just did the best she could, which was smart. I just rejected it because I thought that I was supposed to be okay in order to make sure she was okay.
So I guess that goes into the importance of community and of a village, and having people that, kids are comfortable talking to about things, to where it may not just be the parent, it might be, an uncle. One of my biggest sounding boards in school was my band director.
Mhm.
So like that was the person that, I, of course, I would skip a class and I would go in his office and like have a like one-on-one conversation and just kind of like let out like everything I was feeling at that point. Um, but it wasn't that I didn't trust anyone else. It just felt like I trusted that person the most.
That makes
Um,
perfect sense.
so it's it baffles me that there aren't like legitimate counselors in schools to kind of like deal with kids that are going through things. I think the counselors at my school were more about, you know, what do you want to do with life?
Mhm.
Where do you want to go to college? But it wasn't like someone that can like talk you through issues.
Yeah.
Is that normal now?
Honestly, so I did my internship in my graduate program at a school in a counseling department,
Hmm.
but it was a private school where
Uh,
tuition was $15,000 a year. So that was the first time I had actually really seen a counseling department or services in a school. I do think with the times as we go on, we were used to guidance counselors where they make your schedule. If you have a behavioral problem, maybe they'll refer you out because I think for a while school counselors weren't allowed to do certain things. I think more programs are recognizing the importance of mental health therapy in school. So I have seen a trend where schools are providing that service. Some are still referring out, especially depending on the presenting concern. Um, but honestly, I see it more in private schools and sometimes in charter schools. But just like you said, you went to your band director.
yeah.
Me growing up, I think I immersed myself into social curricular activities, student council, beta club. So I was looking for I think I was looking to be affirmed and I was high achieving because I said, all right, the better I can do, the more I can achieve, the more I'll be okay. And so
Yeah.
instead of finding that band director, I found choir and I found a community of friends that understood me, that allowed me to feel safe and have fun.
Hmm.
And so a lot of my motivation of being a therapist was, all right, now, bro, it's time for you to be what you didn't have. So I had my Uncle Calvin, I had my Uncle Fred. Um, but even though I had these fixtures in place, I didn't allow myself to utilize them in the way that they probably could have been utilized because I was too afraid or I thought something was wrong with me if I had been vulnerable and said, "Hey, I don't really feel well today." So it
Yeah.
was all about school education grades to keep it surface level because I don't think I trusted people to know me when I was growing up and being a kid. So when you think, when you get older, you learn more about yourself and you get to look back and say, "Oh, that's what was going on." And like you skip class. I was so afraid to skip class. And
But I felt like it wasn't as bad because I was still in school and I was with another teacher. So I felt like I,
aha.
I rationalized it to where I wasn't doing anything wrong. It's like I need a moment. And I
Yeah.
mean, I have a I'm fortunate. My mom was very much a parent that made sure we had a voice in the house, as long as it wasn't disrespectful. So if we did something, if I can tell you my mindset going into that situation, I got in less trouble. If I did something that was like, I don't know, or I was there because such and such was there, that's when I got in trouble. So it
Mhm.
was like, if you can If you can rationalize your reasoning, then we're good. So we had a family meeting once, and it was us politicking to have personal days while in school. So I was like, you have days where you don't want to go to work because you just don't feel like dealing with people. We go through the same thing. I was like, so we should get, a personal day per marking period that we can just stay home and do nothing, just to have a day where we can just be ourselves and relax and not be bothered. We
And
presented it. She agreed.
I love this.
And she was like, fair. And it was because like it was a day that she was supposed to go to work. And we got home. We were like, "What are you doing here?" She was like, "I just didn't feel like going to work today. I don't feel like dealing with people." I was like,
Yeah.
"Oh, but we got to go to school."
Man, right.
So,
Let's read.
um,
No, we're gonna talk about this.
yeah. So it became a thing, and she was like, present it to me, present it to me tonight, and we'll make a decision. And I was going to work on that thing, so it worked out. Like through high school, that was our thing. It's like I'm taking a personal day, and she marked it down. You couldn't cheat that up with it. You couldn't double the personal days up, but we had voices basically.
Mm,
Um, and I think that allowed me the space to really sit back and think of decisions that I made at a young age, where most people really don't do that. I had to make sure if I did something, it wasn't I'm just going to go home and get in trouble. It was like how am I going to go home and explain this
mhm.
and make it make sense?
Yeah.
And there's a lot of fails in that because you try to like you try to be sneaky and
Yeah.
get away with stuff. You fail at a lot
Yeah.
of it. Um, when it comes to Black men, um, I know right now there's a lot more attention to mental health, um, and it's not saying that all of these diagnoses and symptoms are just arriving. It's just that we're now speaking on it.
Mhm.
Um, so there's a lot of mention of anxiety and depression and being bipolar, which bipolar back in the days was like he all over the place. Like one day he good, one day he not. He hot today, he cold tomorrow, and it's just you didn't know what it was. So now that like there's a focus in it, is it helping us as far as acknowledging what's there, or are we diagnosing ourselves with deeper issues than what are actually the issue going on?
Great question. Um, I think that it's doing a little bit of both, and it depends on which community you're following.
Okay.
So what I realized about mental health, we are getting better at reducing the stigma by having more conversations around it. We're having more forums. We're talking about it at work. We're having different programming in place. So I think that that's great. I think where we run into issues is where we have the wrong people in certain on certain platforms talking about mental health just because they have a following. And so now
Yeah.
you have an uneducated person talking about depression and talking about mental illness in a way that is misguiding people. Right. So
Hmm.
I'll see a post and someone's talking about statistics and depression and anxiety, and I'm thinking, as a professional who has 12 years of experience, a license, 3 degrees, and I'm thinking, no, where did you get that from? But you have 1,000 likes and 1,000, oh man, I'm about to follow this. That's where we get into trouble because people aren't fact checking
Right.
what the popular people are talking about. So, can I appreciate the conversations that are happening? Yes. Do I think that's helping us? Yes. But even as a mental health professional, I don't think therapy is for everybody at all times. I think
Yeah.
sometimes we have to grow into appreciating it. We have to go for ourselves and be bought into the process. We have to be clear about what we're seeking therapy for. It
Right.
takes courage to recognize, all right, something's feeling disconnected. I can't quite put my finger on it, but perhaps I need to go talk to somebody to help me figure this out. That's good. I
Yeah.
also think that everything isn't a diagnosable mental illness, right? Because I feel sad today does not mean I have clinical depression. And just because someone is moody does not mean that they have bipolar disorder. Just because
Right.
someone is confident and speaks their mind doesn't mean they have narcissistic personality disorder or cluster B personality disorders. And so I think that if we could get more clear about the truth and understand the differences in these things and how to respond to them and what's needed when medication is needed versus when talk therapy is simply needed or when you need a combination of both. That's really important, opposed to just having these very incomplete conversations around mental health, because a lot of it is stemming back to um, poor relationship and people not knowing how to be in relationship with themselves or other people. So then we
Yeah.
just get all these popular forums where people are talking about the differences between men and women, when the reality is no one wants to feel rejected. You probably don't know how to be in a relationship. More people need to believe in divorce and separation because
Listen.
we are saying, well, I'm not going to do this because grandma and granddaddy stayed together 50. Okay. Okay.
You
All
ain't
right.
granddaddy, granddaddy.
You following those footsteps, and you keep beating up on each other. And so I think that, and I
Right.
know that that's harsh, but I'm saying all that to say is that mental health is very complex and sometimes it's very simple.
Yeah.
And if we listen to the professionals, if we fact check the information, if we went and sought our own help, we could probably be more clear about what's going on with us. But I can get started on that all day.
And I think that's how do I do this? I think it's the interesting part of people in society today, right? It's everyone is a presents as a no nonsense. I'm not doing this. You're not going to do this with me. Blah blah blah. But then it's like our tolerance level to allow people to do things in our lives that are toxic is so much higher than what we present as not being that person. So it's it's hard to ask why that is, because every individual situation is different. But in general, is there like a thought of why we tolerate toxicity so heavily?
Yeah. So let's start with breaking down what when we say the word toxic, what we mean by that. And even when we just make it very simple, something that is toxic is harmful.
Hmm.
Right? So when we put that together and we say, oh, you're toxic, or I have toxic tendencies, that means that I have the propensity to be harmful with my behavior, with my thoughts, my feelings, my actions.
Right.
And that can be harmful towards you or within relationship or towards someone else. I think that we have capacity to deal with unhealthy dynamics in relationships because we don't know what healthy looks like.
Mm,
So if an unhealthy dynamic feels good to me or familiar, then I'm going to allow that because that may be all I know because the models that was given to me with parents or family members, that's what they did. So I'm going to follow. Parents often model how we want to be and how we don't want to be. So if
right.
that's all I see and all I know, I'm going to go with that. Oftentimes when we live when we have traumatic experiences growing up, sometimes chaos feels like peace.
Mhm.
So sometimes I'll hear people say, "You don't want peace. You don't want peace in your life." And I have to stop them and say, "Well, do they know what peace is?
Right.
Do they know what that feels like?" So often going back to that conversation around watching other people in relationships, anytime I sit down with one of my clients, we start with, if you're having relationship concerns, we're starting with what models for relationships did you have? Typically, if I am a cheater, if I have inconsistent patterns of dating, if I have lots of sexual partners in my past, it's probably because some lessons have been taught to me that that was okay and that was affirming to me, whether it was big brother or uncle or the man down the street saying, "Yeah, man, you better go do that."
Yeah.
And so I
Yeah.
think we have to first understand what toxicity is and really reassess and learn what healthy is, what it feels like, and realign ourselves with that. Because if my central nervous system can't take separating from somebody, right? I
Mhm.
may not be built to not have this. I'm just going to allow this relationship or this dynamic to happen because even if I get something every third day, it feels better than nothing.
Right. That's a lot. Um, that's a lot. when you when you start making the decision to change that, and you say this isn't working for me, and you get to that place and you say I need to start making different decisions, have different people around me, what is what is the healthy relationship people should be looking for? What
Yeah.
are those qualities?
hmm So I think, so I'm going to be clear as mud here because this is where mental health gets a little bit fuzzy.
Yeah.
Healthy may look different for me than it does for you. So
Hmm.
I get to define what a healthy relationship looks like. When I used
Hmm.
to work for the Big Brothers, Big Sisters in graduate school, we would do this exercise with mentors and mentees, and we would say, if you were going on a ship, a relationship ship, and you only
Hmm.
had to take three things with you, what would those three things be? So that's going to be my model for a healthy relationship because perhaps I need trust, honesty, and constant words of affirmation, right?
Hmm.
That may be my foundation of what's healthy because either I didn't get it or I did and I know what the expectation is.
Right.
For you, it could be physical touch, it could be time spent, and healthy relationship could be, let me be controversial, splitting bills,
Hmm.
because that's what your expectation is. So I think first we have to understand what is it that we need. A lot of people don't know what they need,
Right.
especially men. A lot of men don't know that they can have needs because being a man for some men has always been wrapped up in how you meet other people's needs opposed to meeting yours. Right. So
Yes.
I know
Yeah.
I'm getting into the weeds here a little bit, but first it would start with, well, what do I need? What makes me feel good? What makes me feel sexy? What makes me feel handsome? What makes me stand with my chest poked out? Is it having money in my pocket? Is it having a partner who is supportive next to me? Can I be vulnerable and allow myself to be seen? All right, that's my measure, my foundation of what healthy is. Once I want to make the decision of, all right, now I got to go get this, I have to be willing to separate and endure some pain and discomfort to be without whatever was familiar in order to make room for what is healthy.
Yeah. Yeah. I've noticed a lot of people that I've known personally stepping away from friendships um, of like long standing. And it's like, y'all been friends for 20 something years. Like, y'all need to fix that. And on one side, it's like the person says, yes, we've been friends for 20 something years. No, we don't need to fix this. Like, there's a space that needs to be placed here right now. And I'm okay with it. And it's
Mhm.
just understanding that everything doesn't have to be fixed. Sometimes things need to breathe, and you just have to let that breathe to see if it is a healthy situation to be in prolonged.
Yeah. I literally posted the other day that unpopular opinion, we don't have to fix every problem.
Yeah.
There are times to have critical conversations, and then there are times to just let things be and find peace with letting things be because it may no longer serve me. I think part of the problem that we run into specifically with men is that we don't know oftentimes, A, what we need, but how to let something go. A lot of men
Yeah.
are actually in very unhealthy relationships, whether
Yeah.
they have a same sex partner or not. Men endure, and I'm speaking from this perspective because I specialize in adult men's mental health,
Hmm.
um, that we endure oftentimes unhealthy relationships because y'all been together so many years, you need to work it out. And so now I'm doing this to meet the expectation of someone else because this is what you're supposed to do to have longevity, but no one's really teaching you to how to have health and for you to feel good about the relationship that
Right.
you're in. So I always try to help men understand that you are worth having your needs met in a way that don't bring harm to you or anyone else. You are
Right.
worth identifying what you need and finding a way to communicate that to your partner. The problem is with men is that we get alienated in some cases where we communicate our needs and then we're shot down. So now I've disappeared because I just got to keep my mouth closed in order to keep the peace in this house. that I'm paying for, but I can't say anything. I don't have a place other than the one that my partner wants me to be in.
Right. And then you stop communicating altogether,
Yeah.
which begins it causes resentment. Um, as a kind of like a throwback-ish kind of question, um, during 2020, during
Hmm.
the Black Lives Matter movement, I had a moment after everything started kind of like simmering down, and I thought to myself, watching the George Floyd video, the level of trauma that threw me into, I didn't realize how bad it was. And it wasn't until I was talking to my therapist and I was explaining like how that specifically made me feel. And I understood, or I feel like I understood kind of what people of the past felt when you get to that place of like feeling powerless and it's like there's nothing you could do, but you have to watch this happen. And I
Mm.
felt like it was perpetuated more and more because it kept playing on TV. So it kind of like put a timestamp on this can happen to you.
Hmm.
And when you're supposed to be in a place of feeling safe, just know this can happen to you too. And I just felt like it's something that should have been treated differently in the media. And I kind of blame, my co-media people with that. But it's just, I think that that moment either made you completely rebel against the system because now you feel unsafe again in that space, or you just conform and feel unsafe and try to avoid it at all costs. And I just feel like it was a moment that was a lot more traumatic than people may realize.
Yeah. The thing about those experiences, what you're describing is vicarious traumatization, where it didn't happen directly to you, but because you were a witness of it, you heard about it, then we have this vicarious way of experiencing the trauma. Which even when you think about ACEs, adverse childhood experiences, part of that questionnaire is experiencing or witnessing violence happen to someone else, whether it's
Mm,
gang violence or community violence, because that can still be a trauma of mine as well. It was also happening at a time where we were isolated and we were yearning for connection from people. So here I am stuck in the house trying not to get a disease, which is anxiety provoking.
right.
So then I'm introduced to this other thing that's happening out there where I have no power over it. So I'm wearing my mask, I'm washing my hands, I have my hand sanitizer, I'm staying away. That's what I have control over because that's what I'm doing what they told me to do.
Hmm.
But what do you do when you're experiencing even more anxiety and you're putting more on your plate because you're watching this thing happen to someone that looks just like you?
Right.
I think what happened, I wrote a book about this, not this specifically, but my experience to being racially profiled by the first time. My book is Navigating, I'm going blank, The Courage of a Single Freckle, Navigating Your Black. And it talks
Mhm.
about my different experiences of being a minority male in predominantly white spaces and how I managed that. The reality is trauma is going to look different for everybody. So your experience that I'm hearing from you probably looks different than the next black man and the next
Mhm.
black man, depending on his level of exposure and tolerance to certain traumatic experiences. What do? You figure out a way to cope because, well, we know that we still got to go to work. We still have to put one foot in front of the other. We still have to find a way to hit the gym and connect with ourselves. But sometimes we lose sight of that and not really know how to put our finger on what we need when you're,
Right.
for lack of a better word, scattered because you're trying to manage this traumatic experience. So that's where connecting with other people, finding a therapist, sticking to your community, exercising, all the cliche things, all that matters, but also really being in touch with how does this make me feel right now?
Right.
This makes me feel like crap. All right. What do you want to do with that feeling of crap? Can you really put your finger on that?
Mm.
Oh, I feel scared. I feel scared because my friend or my partner, I need that garage door to open up when they leave 2 hours later. I need to
Yeah.
feel safe in my own home that somebody won't come get me. even me driving as a black man now, I've never been afraid of the police, but every time those things happen, it just got a little bit too close to home, and it's like, all right.
Yeah.
But then I'm playing in my head,
Yeah.
all right, what are you gonna do if you get stopped by the police? What are you going to do? So then we create these narratives on how to keep ourselves safe.
Yeah. And I think that's kind of where the conversations began going. It's a like again, my mom, her preaching to me basically, growing up, it was always you just get home, and then
Mm,
I'll deal with it after that. So you do whatever they tell you to do. You get home, I'll handle it. And I've always kind of just lived with that mentality. Like my job is to make it home. So whatever you're saying, do, got you. I'm not arguing with you. I'm not going back and forth with you. I'm not telling you what my rights are. I'm not doing all that. I'm going to get home and then we will handle it afterwards. Like
mhm,
I remember your name and your badge number. That's all I need. And then from there, we can figure it out later. But it's a kind of like a mentality. And fortunately, that was like drummed into me as a kid. Like just whatever it was, get home. Whether it was like a teacher at school that was like, being nasty, or a principal or football coach or whatever, you go home, you tell mom. Um, so I think that was my safe space um, in that situation. But it was very interesting during that time because there were a lot of people that started presenting again with anxiety. A lot of people started presenting with depression, or saying I have depression. A lot of people, I need to stop saying a lot of people. People that I know of in specific circles were presenting those things, and then that went into medicating
mm.
everyone.
Yeah, yeah.
So it's like, do you need medication or do you just need to deal with this? And
Mhm,
it's trying to figure out that balance. And then again, it's why do you feel the need now to medicate? Personally, I have ADHD. I took ADHD medication the first time 3 years ago. And I told my mom immediately, I was like, you could have had a different child if you would have just medicated me as a younger kid. And she
yeah,
was like, she's basically, you needed to figure it out. You need to figure out how to utilize your gifts and your whatever the other side of the gifts are with ADHD. Figure out how to channel that.
mm,
And it's like now I know I need to focus in a different way. I need to write things out. I need to make sure that like I'm not allowing things in certain spaces that are going to be distracting. It's figuring that thing out that way. Um, all that to say, are we are we turning to medication too easily?
So, 2 things. I wanna answer that question and revisit, what you were talking about. Oh, man, and here I go showing my age, forgetting what I wanted to say.
That I
Boy, I
understand as
tell
well.
you. Yeah. Um, so what you were talking about in terms of, just get home,
Yeah.
that you used the word interesting, but I think if we were able to tease that out, it really feels like a delayed self def it is self-preservation in the moment to just
Hmm.
comply and agree so I can make it home.
Right.
But then there's this delayed sense of self-defense in order to simply make it home and be safe,
Right.
which sometimes looks like enduring abuse and wrongdoing in order to make it home.
Yeah.
Because you could do to me what someone else did to them. And because I don't want that, I'm going to try my best to swallow this
Right.
so I can make it home.
Right.
So I at least wanted to acknowledge that that's what that is. And then because we have to do that over and over again, and we still have to pay bills, and we still have to show up to the function, and we have these expectations that life still demands of us, it gets to be overwhelming. And a lot of people, men, women, kids turn to substances or other unhealthy, unsustainable behaviors in order
Mhm.
to cope. So, yes, I think that we are using medication, but medication looks different for everybody.
Right.
So some people's medication is using pornography or having sex. Some people's medication is popping pills or drinking or gaming all day. So I think to answer your question, yes, we need prescriptions, but it doesn't always have to be from a pharmacy.
Right.
Uh, Prescription could be, how am I taking care of myself on a daily basis that doesn't bring harm to myself or anyone else? It could be restoring my faith and doing some real healing work, breath work, stretching, moving my body, connecting with nature. So I think even when I do therapy, we are looking at a treatment plan, a prescription, but it
Mhm.
doesn't always align with medication unless someone actually needs medication for a mental illness, and then I refer out to my good friends that do that, because I don't. I'm talk therapy, and I trust the professionals that can do that.
Right.
But I also think that it's within reason. You start on a low dose, you talk about it, you get educated, and you understand what's happening before we just start taking things. But if I don't have access to that, or I think taking medicine is going to make me crazy, yeah, I'm a use some weed, or I'm gonna do drugs, or I'm gonna drink, because those are socially acceptable things that I have access to. I don't have access to a psychiatric nurse practitioner. I don't even know what that is. But I know when I
Yeah.
smoke in the morning, I can get through a day, even if I'm working, right? So I think that we turn to what's familiar, to what we believe is making us better. But based on research, based on IOP programs, we know that excessive drug and alcohol use or isn't beneficial. It makes us think that we're okay. Just like caffeine makes us think we're not tired. Drugs and substances make us think that we're okay and that we're in control, when we're not, if we're using it and misusing it excessively.
Right. So something that I do with my friends, not all of them, but my close friends, is like we just kind of like a mental health kind of check in. So it's a easy like how's your heart kind of question. Um, what's I would love to say that like that's the way that everyone should approach their friends and kind of do
Yeah.
check-ins. But what's a way to check in on other black men, um, not necessarily on a regular basis, but just making sure again, like the strong friend isn't going through it.
hmm One thing that I do at every start of my sessions with men is asking, "How are you feeling?" And I'm amazed at how often that catches them off guard, because they realize, well, I don't know when the last time somebody asked me how I was feeling. So they
Yeah.
have to sit with that in order to intentionally answer the question. And we don't, in my office, we don't just say, "Oh, I'm good," because what does good mean? You said that
Yeah.
to the last 15 people that you passed
Yeah.
on the elevator. In here, in this space that you carve out for yourself, tell me how you're feeling. Check in with yourself. So I think asking the question, "How's your heart? How's your soul? How are you feeling?" is a good way to checking in, instead of "You
Mhm.
good?" Because "You good" is really, that's leading, that's guiding you.
Yeah.
Say you're good so I don't be uncomfortable, because I can't deal with whatever you may say.
I was gonna say it's almost it's a question basically saying say yes because I
Yeah.
don't I'm not dealing with no. Like
Yeah. Yeah.
you good, right? Like
Right,
because
right. So
I don't
I
got time to
think
do
that exactly. I don't have time, I don't have capacity, I also don't know. I'm just saying this because this is what we do. This is how we greet each other.
that. Right.
Uh, but I think when you really do have capacity, when you really do have interest, it's okay to ask certain questions where you can get more answers. So open-ended questions, how are you feeling? Um, Asking them, tell me, what was the best part of your day today? What was the highlight of your week? What are you looking forward to? What do you feel anxious or upset about? What went well? I think some of those questions are really good ways to check in. If I know, my homie has a procedure coming up or has an interview or something, I may mark it in my calendar
Mhm.
to say, all right, just send a text, check in, because that makes people feel seen.
Yeah.
When we talk about how to check in with Black men, it's really, how do I allow this man to feel seen today? acknowledging something that's special that's going on, asking about something he feels passionate about, checking in on how he's feeling, paying attention to his body language when he's disconnecting. We know our friends that have the patterns of, I ain't heard from him in a while. He must be, let me just check on him. Let me not assume that he's just locked in somewhere focused, but
Right.
also let me not assume that he's about to give up on life. So let me just do what I can. Maybe I can't send you $1,000 because you have financial problems, but I can at least check on you so that you know that I see you.
Right.
So I think if we started there, kept it simple, that's a really good way of allowing ourselves to check on the people in our lives.
No, absolutely. I think my last question, it's numbers are all over the place, but the narrative is that suicide amongst Black men is at pretty much like its highest levels. Is that accurate, or is that just something that's being thrown at us to kind of make us look at things from one direction or another?
Yeah, I think it really depends on which study you read.
Okay.
Some studies will say that during the pandemic, numbers went up for suicide rates among Black men. Some studies will say they went down. I think the reality is, based on the research I've done, is that we learned how to connect with people during the pandemic. And I'm even
Hmm.
just going back then because years ago, suicide had been the leading cause of death. Uh, then from a cultural standpoint, we thought suicide was only white people or white women, when the reality is everybody, no matter what you look like, there are numbers and statistics for suicide rates.
Right.
I would say, based on the research currently, Black men are continuing to die by suicide. I don't think that it's at this astronomical number that people are saying as a scare tactic or a sound bite, but it is
Hmm.
happening. It is real. So we don't want to dismiss or discredit that. I do think sometimes people in the media and social media say big things to get a big reaction.
Right.
That's just based on what I see as a mental health professional. But I would even say less than 6%, somewhere between 6 and 12% of adult men report having depression. We know that number is off because not all men, specifically Black men, are going to report accurately. Also, just because you have depression doesn't mean that you all automatically have suicidal thoughts. And
Right.
just because you have bipolar disorder or mental illness doesn't mean that you have suicidal ideation. So I think I at least wanted to put that in there to normalize the idea that you can have mental illness, which is a diagnosis, and live a thriving life. You can also not have a diagnosable disorder and have poor mental health and struggle. So I think the
Mm.
differences, but knowing the differences between mental illness and mental health is really important. Mental health is how we take care of ourselves and cope with the world around us on a regular basis. That's waking up. All right, what do I want today to look like? Dang, I feel sad today, or I feel really high. That's mental health. I can cope with, man, this person cut me off, to, dang, I have a family member in the hospital.
Yeah.
That's managing our mental health, identifying what we need. Mental illness is a completely different beast. But the suicide rates, I would say, the last study I saw, maybe 20% of Black men have been reported to die by suicide. But I would say studies are constantly changing because there are studies always going on all over the US.
Yeah. It's amazing is the words come to mind. That's not, I don't think that's the word I want to use, but it's amazing how much, I guess, weight we carry on our shoulders as Black men when it comes to our mental health, our mental well-being. Um, and a lot of it is very much unspoken. And we're told that we're strong if we can do that and handle it. But I think that a lot of strength comes in being able to say that I'm not okay today. Like,
Mhm.
this is becoming too much. I need some of you to take your weight off of my shoulders and figure it out. And I think that that's somewhere that personally I found that space around 40. It became very much a, I'm not dealing with this. This is yours. Handle it. Like, I'm not carrying all of everyone's baggage anymore. Because again, it puts you in that space of feeling like you have to make it work for everyone. Like, you have to fix everyone's thing. And then when you realize that's not your job, it makes life a little bit easier because I can be empathetic with you and not take it on. Like
Yeah.
I can give you some advice on what I would do and not take it on. Like it's
Mhm.
just the take it on mentality. And I always say it's the pouring out of your cup to where you're empty to fill someone else's and no one's pouring back into yours. So I think that it's amazing that we're able to do it, but I think we need to stop doing
Yeah. And unpopular opinion, we don't really do it well. We we make it look good
Yeah,
sometimes
yeah,
because we're still showing up but we're running ourselves ragged. So,
yeah,
and when I say we're not doing it well, because we're secretly addicted to porn and we're secretly doing drugs and we're secretly getting wasted on the weekend or being being unfaithful to so right, so we're finding these ways to, I'm gonna take it all on, but I'm gonna do all this to cope because I'm really
yeah,
tired, exhausted, I need help, or I'm gonna
yeah,
lie about it and not feel safe or seek therapy because that's not what men do.
yeah,
So yeah, you're right. I think strength is really asking for help, using your resources, knowing when you need to take a day off, knowing that you can't vacation your way into a healthier lifestyle, knowing that
yeah,
it's strength to say, you know what, let me reach out, let me schedule 3 consultation calls to see who I vibe with the most. Maybe I'm not ready for therapy, but let me see if I can find a community of like-minded men. Let me see if I can just put a friend date 2 times a month on my calendar to connect with my boys. Maybe therapy isn't accessible to me, but I really enjoy Friday nights at the court. I
right.
really enjoy making sure I keep up my barber appointment because, boy, when I get out that chair, the world gonna see me, right? Starbucks, I don't even drink Starbucks. I'm in Target. I don't even like Target. So I think doing those small things in between can really help and support our mental health. But yeah,
Yeah,
knowing when to say yes is just as important as knowing when to say no.
absolutely, absolutely. Dr. Dawson, it was a pleasure, man. It was a great conversation. You are always welcome on my platform. Um, I
Thank you for
would
that.
I would love to talk to you for hours on hours, but we all have things to do. So I'm
Right.
not going to hold you up.
Responsibilities. Right. Here we go. We got to take the
Right.
weight of the world on after this.
go
Pack it
go
on.
put go put on your cape.
Exactly.
But if anything, if you need anything or you need us to, highlight anything that you're doing, let me know. I'm
Okay.
more than happy to help out. I think it's an important message for us to get out there and encourage more men to talk.
I
We don't do it
agree.
enough.
No.
So
Well, I think we did a good job today. I appreciate you connecting, giving me the space and sharing. I think great conversation, man. I really, really, this was the highlight of my day.
I appreciate that. That makes me happy.